Scan 5. Scan 5, also referred to as Scan 4-5, is used to take the bite. Scan 4 is in the left window, and Scan 5 is in the right window. When you set up to take a Scan 5, the K7 will prompt you to enter the patient's vertical index and width of the central. After you input these numbers, the K7 will calculate the golden vertical and display it as a yellow dotted line on the screen. After aligning the sensor array, ask the patient to let their jaw hang and relax. Press the space bar to start recording data. You should see a steady pulse in the vertical and AP tracings as they sweep across the screen. After the purple line, ask the patient to close, tap twice, stay closed, and slide their jaw forward. Press the space bar to stop recording data. Let's take a closer look at this scan. If using the golden vertical, the patient's rest position is typically 1 to 2 millimeters below the golden vertical line. You must have a pulse on both the vertical tracing and the AP tracing. A typical pulse is 1/2 millimeter to 1 millimeter. The minimum pulse required on both the vertical and AP tracing is 1/4 millimeter. Keep in mind that each square on the screen is 1 millimeter by 1 millimeter. For the lateral tracing in green, this line should be flat with no pulse. If there is a pulse on the lateral tracing, you will want to try and eliminate the pulse by using the balance control on your J5. You should not have to move the balance control knob on the J5 beyond 10 o'clock and 2 o'clock. If you cannot eliminate the pulse on the lateral trace, it may be an anatomical issue. After the purple line, have the patient close on their back teeth to CO. Tap twice, stay closed, and slide their jaw forward. Make sure that when the patient slides protrusive, that they do not get above their CO on the screen. Doing so will throw off your data. Press F5 to save your data. Press Escape to change to full screen, which is in the sagittal frontal mode. Press the M key to mark the myocentric target on both the sagittal and frontal tracings. You are now ready to take your bite. Align the sensor array, have the patient open without moving their head, shoot the bite registration material, and slowly let their jaw gently float up until the cursor is on the myocentric target on both the sagittal and frontal tracings.